here. I'm finally finished the playthrough of Prototype 2 on my gaming account, which if you're interested in looking at, I'll put a link up here. Since I've finished that, I've now got a lot more free time to concentrate on doing my videos through my normal account as well. Something I want to talk about is psoriasis and eczema, which I personally suffer from. Eczema I've had since a kid basically. I had infantile eczema, so I'd really scratch my skin until it would start bleeding. It's not backwards, but it's a catch-22 situation. You've got to stop scratching to stop it spreading, but obviously the scratching helps relieving your symptoms temporarily. Eventually when it starts flaring up, you start scratching again, so it's a bit of a sod. Obviously the childhood remedies were, if you were really bad, to put bandages on your hands, which would result in screaming babies, but you could also use calamine lotion to help relax the skin. As for psoriasis, it's an autoimmune disease brought on by stress, basically where your body's skin cells keep overproducing. So obviously your body doesn't know when to stop creating them, and you end up scratching your skin a lot more, which in my scenario makes it worse for me, because obviously when I had psoriasis it was really bad. Just a quote from the Wikipedia article here. So if you want more information on psoriasis, I'm going to post some links with obviously the links to Wikipedia. Psoriasis is an autoimmune disease that appears on the skin. If you don't know what autoimmune is, I'll go down now. The autoimmune disease arises from an inappropriate immune response of the body against substances and tissues normally present in the bodies. In other words, the immune system mistakes some part of the body as a pathogen and attacks its own cells. This may be restricted to certain organs, e.g. autoimmune thyroiditis, or involve particular tissue, commonly in different places. Obviously psoriasis cells, when your skin are reproduced, your skin ends up looking all flaky, so you look a bit like a leper, and essentially people get a bit iffy around you, which obviously if you have psoriasis like me and it's brought on by stress, it can make you scratch more, essentially, because obviously when you stress, I do like a automatic subliminal response where I scratch when I'm stressed, and I scratch when I'm itchy and stuff like that. And obviously if I'm stressed and I don't realise it, I'll scratch. That's what caught me psoriasis off. So a bit more from Wikipedia. Psoriasis is not contagious. However, psoriasis has been linked to an increased risk of stroke. Nice. Now I'm going to get fucked with all that. And treating high blood lipid levels may lead to improvement. No clue. There are 5 types of psoriasis: plaque, guttate, inverse, pustular, and erythrodermic. I can't pronounce that one, sorry. The most common form, plaque psoriasis, is commonly seen as red and white hues of scaly patches appearing on the top first layer of the epidermis. Some patients, though, have no dermatological symptoms. Also, the way you can identify psoriasis, if you don't know if you've got it or possibly may have it, is what I read up on it is if you're scratching your skin cells, when you obviously scratch them off, you have tiny little spots where you can see little sort of pinprick dots of red blood, and that's where you've scraped the skin cells. That's psoriasis, or usually is anyway. In plaque psoriasis, skin rapidly accumulates at these sites, which gives a silvery white appearance. For reference, I did, when I first had psoriasis, I had it on me elbow here, and it eventually developed up here. I don't know if you can see in this picture. I'll put the light on so it will be bright, but you can't really see it there. But in psoriasis, when I first got it, I've now, my skin there, you can see here, this bit here, so it's not slightly discoloured, I mean it fades anyway, but you can see like that there. I was scratching all around here like this, and that there, you can see like it's whitish there. That's just dry skin now. But around there, I was basically going like that subconsciously when I was talking to people, and eventually spread. Yes, I know, itch and talk makes you itch. So it's a hard thing to get over, and it's with me for life basically, but I've learned to live with it. Bit more info, and I'll go into what this video is about basically. Plaques frequently occur on the skins of the elbows and knees. but can affect any area including the scalp, palms of hands and soles of feet, and genitals. In contrast to eczema, psoriasis is more likely to be found on the outer side of the joint. So you're talking about the outer sides, not like the inner sides, like inside your elbow here, the outer sides like that. The disorder is a chronic recurring condition that varies in severity from minor localized patches to complete body coverage. Fingernails and toenails are frequently affected. Psoriatic nail dystrophy and can be seen as isolated symptoms. Psoriasis can also cause inflammation of the joints, which is known as psoriatic arthritis. Between 10 to 30% of all people with psoriasis have psoriatic arthritis. No clue what that is, but don't care. The cause of psoriasis is not fully understood, but is believed to have a genetic component, and local psoriatic changes can be triggered by an injury to the skin known as a Koebner phenomenon. Various environmental factors have been suggested as aggravating to psoriasis, including stress, withdrawal of systemic corticosteroid, as well as other environmental factors, but few have shown statistical significance. There are many treatments available because of its chronic recurrent nature. Psoriasis is a challenge to treat. Withdrawal of corticosteroids, topical steroid cream, can aggravate the condition due to the rebound effect of corticosteroids. Christ, I feel sorry for you doctors. How can you pronounce these things? Anyway, right. So I have psoriasis and I have eczema. When I was a kid, I also developed folliculitis. There's two things what I'd like to mention. First, when you've got them, or rather if you think of the symptoms, identify the possible cause of it. For me, eczema. My eczema is controllable because I've had it since a kid. Basically, it's essentially when my skin sweats. It gets it makes it itch more because it's so obviously hot summer's day. When I usually rub the back of my legs a lot because it agitates my skin when it's sweating. Also, citrus fruits like really fresh orange juice for some reason agitates. I don't know why. And tight-fitting clothing can do that. So it's particularly my work clothes, which is what brought on my recent bout of eczema again, which is bloody irritating. But so loose full, obviously. Mine was skin for that, and then loose fitting clothing was the solution for it. So for me, psoriasis, it's a case of identifying the problem. It was stress, essentially. Whether that can be what you can do, your first thing to do when you're identifying the cause is find out what's causing it, and that way you know what you can do to treat it. Whether that be change jobs or just see if you can help on some scenario or ask for help. My psoriasis was with me with stress. I mean, first time was because my first ever job I worked in, I was essentially, it went from something good which I enjoyed to, before I left, I got folliculitis, which was a hair follicle infection, which here I've got a scar on my head here and around my eye there. Look, people who know us will know I looked like I was punched, because my face was all swollen up. That was a hair follicle infection, which I think I got antibiotics for it. And then a couple of weeks later, I got my psoriasis, which I had to take time off work for again. At this time, this was when the company was going into redundancy, and I was starting to get stressed about my work. The second time when I was affected for it was just to stress, worrying about my family, and it was a time when it was when my dad was dying. And obviously the third time is just stress about family again. But I've learned to cope. I've learned to cope with it in a way because my family depends on me, but that's just the way I am. Anyway, as for solutions to psoriasis and eczema is more commonly known. You can use, I don't know what the word is now, the cream anyway, calamine lotion. I couldn't think of what it was called, but that's the common treatment for eczema, or loose fitting clothing, which you can use. In regards to the psoriasis, if you're getting it really bad, which I did, if the skin's become infected, you usually have to go to see a doctor. Don't be panicking about going to see them and showing your body. They've seen it all the time, and that's what they pay to look at. They pay to sort your problems out for you. But I mean, I went to see mine behind my legs. I got eczema, and on me, all across my back, I was actually scratching me back of my skin with a knife because it was becoming that serious. It was just irritating the hell out of my skin, and it's calmed down a lot less now. So my back's a bit better now, and obviously my lower back, I was scratching that a lot. But combined when I have my eczema, it drives us absolutely crazy. So the treatment for the psoriasis, some people have been known to use sunbeds. Supposedly the UV rays is quite good for you, or whatever it is. I don't know, sunbeds I don't use them, but supposedly sunbeds is quite good for if you've got psoriasis. It doesn't aggravate the skin. One of the things which they first prescribed to me when I had psoriasis was aqueous cream, because some of the problems which you can get is because your skin is too dry. So what they suggest aqueous cream because obviously it helps keep your skin moist. I can't use it myself personally because I find when I get something on my skin which puts an extra layer or barrier on top of it, it actually makes it scratch more. For some reason it aggravates my skin. So the first time I went to the doctors, the first time when I had my psoriasis the first time, I was given Dovabet, and which is I was given another one. I'll go over in a minute because I've got my but I was given a cream. The first time it was okay, but it wasn't strong enough. The second time I was given a Dovabet, which is a steroid based cream. I think it contained calcipotriol. That might be what I'm thinking of. It was a steroid based cream, and then I was given some antibiotics called flucloxacillin, I think, if I've got that right. Don't quote us if I haven't, because I don't particularly care, and obviously I'm not a doctor. But anyway, first time I had it, I got that, and it helped clear it up a lot. The speed at which your body recovers when you're using the antibiotics is great, so it's another reason you go to your doctor. Just get yourself out of the misery, go to the doctor. I mean, if you're on things like a wartime pension or government benefits or whatever, you get the prescriptions for free, and if not, you pay about £7.85 I think per prescription. I mean, my recent one cost me £21, but obviously in the UK where you get free healthcare and prescriptions is all you pay for, so it's good link. I'll put some links in the description anyway. So first time round, my body recovered quickly from using that. My most recent bout, I caught me eczema on my legs and my psoriasis on my back, my stomach, because it was really what I was finding doing. It was agitating my skin. Is that when I was drying it, after the bath, my skin, when it got hot, when it was starting to cool down, that was when it was really going crazy on my skin, and I was itching, and I couldn't. Obviously, I ended up getting spots and marks all over my stomach and my back because it was irritating us. Which, if you knew me, or if someone looked at you like that and started commenting about it, if it was me personally, it would make me get stressed more and I'd end up itching more, which is a backward cycle. But that's why, if people know you have eczema or psoriasis or things like that, I don't personally believe they should judge you, because at the end of the day they don't know what's affecting you in your personal life, and obviously it can make your symptoms more severe. But anyway, enough of that. So when I had my eczema, I went to the doctor. This was probably a couple of weeks back. I went to the doctor, I showed me back my legs, and obviously it was my eczema. I explained what the symptoms were, so that when I was getting out of the bath, and obviously she had a look from my previous history, she suggested using a moisturiser and can't remember what it's called now. Moisturiser and a barrier cream to protect it. And obviously I was given me a prescription which I've been using, or partly anyway, but it seems to do the job. Anyway, what I was given was that stuff there. It's called, I'm actually putting this the right way around. Hopefully that. Why the hell? No, hopefully it's the right way. If not, tough shit. This is called Fusabet. It's a fusidic acid bentamethasone. I feel sorry for you doctors anyway. This was used, basically, it's a very strong, it says applied twice a day sparingly, and contains a potent topical corticosteroid to be spread thinly. Contains fusidic acid and bentamethasone. I have absolutely no idea what that means. But basically, this is what I was given for my eczema. I just apply it very light. I'm talking very lightly, like only enough on your finger and just enough as if you were just rubbing it in your skin. That helped treat up my eczema. She was saying to use it basically for because I got 2 tubs of this. She was saying to use it for just use it sparingly for 5 days. Obviously, if it interferes, just to stop using it, but to use that sparingly for my eczema. What she also gave us was the stuff which I know is Dovabet. This is calcipotriol, which is that thing I was on about earlier, and bentamethasone. I haven't actually used this yet, but this stuff is really good for your psoriasis. Personally, it's a lot like the first stuff. This calcipotriol, it's more like aqueous cream in texture. So if you can't use that, if you can't use aqueous cream like I can't, you may want to try this. It does contain a steroid in it, but a topical cream, and is it topical? I don't know, but it's a lot like Vaseline in texture. So it essentially helps keep your skin moist but traps a barrier. This is what I was thinking of when I first looked for it, because obviously I needed something which is more like Vaseline texture, because I've used that before. And what I've also given, which I've used before, this stuff, it's like Vaseline, it's Epiderm. This stuff is great. I believe you can use it in the bath as well, I'm not sure. Yeah, it says emollient, bath additive and skin cleanser. It's got no colourings, fragrances, additives or preservatives. Low sensitization suitable for all ages, including babies. Developed by dermatologists for eczema, psoriasis and other skin conditions. This stuff, what do I think of it? I don't care. This stuff, it's what you're supposed to do is put your cream like your Dovabet or your Fusibet on, and then once it's dry, you use this and you put this on like there. So I don't know if you can see that there. You can see it is literally like Vaseline in texture. So might look a bit stupid, so you might want to put dressings on it, or if you don't want it to stain your clothes. But this stuff, it does help your skin a lot, personally, in my opinion. If you've got it and you can't use like creams which are more water based. If you want to do the cheap approach, what I did is I went to Asda. I knew what I was looking for because I'd used Dovabet before. Find the book. You can go to Asda or somewhere similar to it, and basically what I got was baby oil. You may think it's stupid, but essentially all I'm getting for here is Asda Little Angels baby oil. It's probably about £1 a bottle, and all I did basically is just in a hot bath. This was the same day I went to the doctor's, but I wanted to try it. This was a couple of days before I went because I wanted to try it out. But I bought this, it was about £1 a bottle. You just run a bath and just squirt a bit of it in. I'm not talking major loads because your bath does go a bit slippy as well. Probably a quick squirt and that's it. But you'll know when you're washing your body with it, because essentially it's like if you pour water on your hand and then pour it on again, you'll see it running off. Or if you put your hand in oil or something like that, put your hand in oil and then put water on it, you'll see it run off. That's what it's like. And your skin is a very weird feeling, and it's like now because I've just had a bath at night. But I personally found bathing in the baby oil was great for me scratching, because it traps your moisture in your skin while you get in the bath, but it wasn't irritating it when I was getting dried. And I did personally find that with me psoriasis and eczema, the first night I actually used it in the bath, the same night I wasn't scratching severely. I was scratching because my body was still irritated, but I wasn't scratching to the extent where I was like the other night, and my body was a lot calmer, so it made it easier for me to relax. I don't believe you have to have a bath in it every night, because I think it probably would be over the top, but I've found that I know when my skin's sort of drying out now with the moisturiser, because it's a very different feeling when your skin's like that. The only way I can describe it is if you basically just put some, I don't know, stuff like vegetable oil in your hand, and then vegetable oil in your hand and go like that, and then pour water on it, that'll run off, and then just dry off your hands, and if it's still got some in, just go like that, you'll feel it straight away. It's just very sort of smoothness on your hand. But I personally recommend using that as your first approach if you don't want to go to the doctor, and then after that they'll either try you an aqueous cream, or if you know you can't use it, just suggest them the Dovabet or the Fusibet. I mean, I can't suggest them anywhere, but if you know what you're looking for, they may be able to help you out quicker. And I just want to discuss that. I mean, obviously there's a few people know me and know my channel, but if you found this channel through looking for it, hopefully it'll help you out, or at least give you a bit of a symptom description. But my final ending note is if you obviously if you've got a problem, find someone who'll help you fix it, because obviously stress is essentially like water. You can only hold so much of it, and then eventually you either break or it just overloads you, and that's when everything breaks down and you have a mental breakdown or whatever. But if you've got a problem, share it with someone, friend, family, doctor, because everything's confidential between them. A good friend really will keep everything secret between you. And obviously, if you don't feel comfortable talking to your friends or your family, just speak to your doctor, because they're bound by, I think they're bound by law to be confidential anyway, due to the patient confidentiality thing. But hopefully it'll help you out, and obviously it might help someone who's had similar issues to me, and may know where I'm coming from making this video. And obviously I just want to relay the message to pass it out there, and obviously because stress is a bit of a killer for you. It can drive people towards suicide, so it's best to get it out of the way and obviously relieve the symptoms for someone to make their lives easier. So obviously end a note there, and hopefully I'll get some responses from this, from people who helped out or people who just think that it's useful information. And obviously if you like the video, share it, favourite it, whatever. I mainly just want to get the video out there. Thanks very much.